Hi there, this is Thao Allen, one of your physician assistants here at the Virginia Spine Institute. Thank you for joining me today to listen to a topic that is super important for our patients during their surgical recovery. The topic is constipation. So it's not a fun topic that patients really like to talk to us about, but it's the most common subject and something that patients go through and can be difficult to manage, especially when they need a provider to help them through it. So what better way is you can keep using this video in the safety of your own home and get some good tips on how to manage this after surgery, okay? And so it's typical or it's normal to have constipation because you're on pain medicine, you're not drinking well, you're dehydrated, so it's really common and normal. But it's not a good feeling to feel constipated, so my answer is you want to treat constipation before you start feeling it. So what are some safe options? So our recommendation, or my recommendation, is start off with a mild stool softener and a mild laxative. So that can be docusate sodium, which the brand name is Colace. That's you can take 1 tab twice a day, and also another kind of mild laxative is called Miralax, which you could take once daily and follow the instructions. So these two medicines, taking it every day, typically is mild and easy on the stomach and can help to prevent feeling constipated. And typically after the surgery, hopefully you're on these medicines daily for about a couple of weeks. And then once things normalize again and you're off the pain medicine and you're hydrating well, you shouldn't need to take these medicines beyond that, okay? Well, let's talk about the next scenario. What if it's been 3 days or more, you haven't had a good bowel movement, you feel really full and bloated, and what is next? Because you've tried everything and nothing's working. Well, there's another 2 options you could try. The first medicine is a type of laxative suppository. A brand name could be called Dulcolax. And so it's a medicine, of course, that you administer rectally. The medicine gets absorbed through your body, and it helps stimulate the colon to pump and for you to have a bowel movement. So it's a nice, easy option to try. But if you're not into trying a rectal option first, then another great option, which is oral, is called Magnesium Citrate. So it's a 10-ounce bottle. It's super cheap. It comes in different fun flavors, and so you would start off drinking half the bottle and wait for an hour or 2 to see if there's results. And if it doesn't work, then finish the rest of the bottle. And usually by finishing the whole bottle, typically it's gonna work. So you're welcome. So hopefully that's enough and that's all you need. And my recommendation again is pick up a few of these items and have it in your medicine cabinets in case you need it, instead of being in crisis mode and having your loved one run out to the pharmacy in the middle of the night. So, but let's say the magnesium citrate doesn't work, then what's next? Then the last option is, it's called a Saline Enema, and a brand name would be called Fleet's Enema. And so you'd follow the instructions on the bottle, you would administer it rectally. The medicine then gets absorbed through your system and also helps stimulate for the bowel to go. And typically, this should work. This is the last rule, but it definitely will work. You know, most patients don't love the idea because it's slightly uncomfortable, but when you're really feeling constipated and you're really miserable, you're gonna wanna try it. So it's a nice option to try. And if none of this works and you're really you don't know what else to do, of course, call your provider and we'll help you. And we'll guide you through what the next step to take or what to repeat again possibly to see if it works. You know, unfortunately, some patients may need to be directed to an urgent care or a medical facility because they need what's called manual disimpactment, where a provider will have to manually remove the stool in order to get you going again. But again, the goal is to avoid that. So hopefully with these medicines, it'll work, okay? And so let's switch gears to what are dietary options that you could do kind of to help avoid constipation. The most important thing is to stay hydrated. Drink plenty of water after surgery, super important. And if water's too boring and you can't drink a bunch of water, then there's really nice sugar-free and low sugar options that you can try to keep staying hydrated, because it's super important during your recovery. And also consider fruits and vegetables, foods that are high in fiber. Again, trying to integrate that with your meals, it's really important for you to help the bowels to keep moving. And of course, it's really important for your nutrition as well. So having a well-balanced diet will help you, give you the calories that you need to help you with your recovery and to heal, okay? And so hopefully these are some good suggestions and recommendations that I've provided. And stay tuned till next time. Thank you very much.